Hello, welcome to Limitless. Today I'm excited to speak with Kate Alexander, the founder and CEO of NurseWatch, a premium at-home aged care provider known for its focus on social wellness. Kate, thank you for joining us.
Thank you.
Kate, you founded NurseWatch in 2016 with a vision to transform the at-home aged care industry. So, what inspired you to take this step, and how did your background as a nurse to influence this decision?
Well, I've been nursing for 40 years, so I've seen quite the span of provision of healthcare. As a child growing up, it was very much community based. It was a GP driven model, and at some point, it changed to more of a hospital um, driven model, and we were going to hospital more often. I mean, in between that growth, there was a lot of medical innovation. And then at one point at the end of my career, we combined with public health policy, changed people's quality of health, and we started to live longer. Public health policy like um, bowel screening, dental care, mammograms, none of that existed. So I looked back and thought that we need to do things differently. And what were the benefits of the 40-year span and how to bring that into our model.
Yeah, sure. So, NurseWatch combines professional care with social wellness programs. So, what drove the decision to integrate those wellness activities, and how have the clients responded?
So in that years of 40 years nursing, one of the other things that occurred was we were becoming a sickness model. We were getting a lot more chronic health um, illness from poor lifestyle decisions. So we needed to reframe that. And a lot of that was driven by by funding. It was not driven by lack of knowledge, people living longer. That combined with public health policy, we needed to stop that cycle of poor lifestyle choices, which then enabled chronic health, which then puts a great pressure on the system. So what we're doing now with having our clients enter in at wellness, that we're hoping to collect data saying that we're either minimising or completely eliminating chronic health.
I see. So, what have you been the biggest challenges you have faced in growing the nurse watch, and especially in such a regulated industry like aged caring?
So our biggest challenges has been reframing people's thinking. Because this technology has really come about quickly, we've also had COVID. We've also dealt with a lot of financial strain on our health system. We had a very healthy, luxurious health system. And then, of course, we've probably, not consciously, but taken advantage of that. It's really cannot be that healthy anymore. So the biggest challenge was reframing people's thinking around what the government can provide. The present cohort that are aging pensioner base historically because they weren't from super funds, they can't fund their own health. And also, we are a public hospital, public Medicare based framework. So, our biggest challenges was reframing people to think about their health now in the baby boomers, the youngest of the baby boomer era, the late 50s, and to start what they do now because they're potentially going to live to at least 100. So they've now got superannuation. So they've now got to look at their health. So the biggest challenge was reframing that view that you can have quality of life, but you need to look at what's going on now, your lifestyle changes. And look at genetics as well. We've got a lot more information on genetics and also, look at how you manage your lifestyle skills, how you're driven by emotion, your behaviours. That's another layer along with your genetics.
Yeah, so NurseWatch has been awarded prestigious certification like Global Mark and the Remotic. So how do those like accreditations impact your business and service you provide?
Well, certainly it develops the culture. I really wanted a culture that's inclusive and embrace diversity. If you have a diversified workforce, it brings lots of positive attributes and input from people's different cultures. We're also a global business, and I think it's important that you start off with the right intentions. And I think, good staff, intelligent staff, then bring good and intelligent
That's
staff
true.
along as well. Good brings good, and quality brings along quality. Uh, we were we provide hospitals in the home, so really I used to be an ex-auditor, so it was important for me to have the systems and processes in place because that ensures that you have quality health outcomes, and it also sets everyone up for success. Everyone who works for NurseWatch, has a framework to work within, and everything is there for them. And if it's not there, then if it comes up that it's not there, then we work out why it's not there, and then bring that process or system in place. And I wanted that from day one. We first had our first audit October 2017. And of course, you can imagine, only been open for a year, we had a number of things that needed to be addressed. And it actually took us 2 years to get our policies and our procedures refined, and 2 years of auditing to ensure those audits actually made sense. We weren't just tick boxing. And also hospitals in the home. So really, what you see in your hospital building, we can do at the home. So it was important to have that framework for us to grow. Governance is important in health, and it also then leads up to quality health outcomes, and that's really what we're about, is maintaining your health outcomes or improving. Yeah.
Yeah. So as a leader in the healthcare industry, what leadership lessons you have learned that would benefit other people looking into make a difference in those healthcare industry?
For leadership, it's big thing is about being inclusive and providing your staff with the confidence that they can do their job effectively, because they know what boundaries to work in. They're not going to go outside, for instance, their expertise or their scope. It's very important that you don't have someone doing something that really they're not skilled for. Um, I think that's a big leadership, and to have smart people around you. And if you have that, you attract smart people, and then smart people come with other smart people, which makes it really interesting.
You're already built this screen.
Yeah.
So looking ahead, what are the goals you have for the NurseWatch, and is there any service or partnerships you want to build up for the future?
Yeah, we'd like to provide the whole continuum of care. So we would like to actually partner with the day hospital. Our focus is the youngest of the baby boomers, 58 years and over. So we would like to partner with a day hospital that they could do the surgery, then be discharged into our hospitals in the home program, and then we can manage them at home. There is data, worldwide data, that people do better at home. For us, it's about risk managing what could go wrong at home. And so that would be our next partnership. So we could do the whole continuum of care. We've certainly got clinical wearables. We've got our own technology. Our own doctors can access our Audit 4, which is our medical software. So we've got our digital ecosystem. It's now partnering with companies that can give our clients the whole continuum of care. So once they join the NurseWatch community, they can stay within us, and we can do their whole care journey till they decide to meet their creator, which would be quite a honour.
Okay. So for those entrepreneurs who is interested in entering those aging care industry, what advices you want to give to them?
people entering the aged care.
Yeah.
Have purpose and be passionate about. I know people mention that word passion, but purpose. And to be interested in the older person and to ensure that you have the skills. It is a specialist field. It's an interesting field, and I think about what area of healthcare you'd like to be. I was always interested in the older persons. Yeah.
Yeah. So, Kate, thank you for sharing your journey and the inspiring work you have done with NurseWatch. So it's really incredible to hear how you transform the aged care industry. Thank you.
Thank you.